Hey, what's up, everybody? My name's Jimmy McGill, and you are watching The Recovery Clinic. I've got an excited show for you today. Unfortunately, Chris Dickey won't be here, but we've got something spectacular for you guys, and we've got an awesome person. But first, hit the like button and follow this page. If you don't know what's going on, this page was created for people in recovery from substance use and that are struggling with mental health stuff during COVID. See, COVID shut down a lot of things. What it didn't stop was addiction. It didn't stop overdoses, and it didn't stop the mental health crisis that we battle every day. And so this was our way of offering up a solution in the state of Arkansas to those who are still suffering from those disorders. And so we've got a spectacular show today. We've actually got my friend Jennifer, and Jen is amazing. She has helped me along my personal stuff and professional stuff for the last couple of years. Jennifer Shuler is actually the DHS medical expert. She's a nurse practitioner. And Jennifer is actually leading the development of the COVID stuff for DHS. And she's a person who's very passionate about helping people like myself in recovery. Jennifer, what's happening?
Hi, Jimmy. Thank you for having me on the show.
I'm glad you're here.
I'm not going to lie, my feelings were a little hurt you haven't had me earlier.
Oh, well, better late than never.
Well, I'm sad that our friend Chris can't be here, but I understand he's got a lot going on.
Yeah, he does.
So,
new treatment center and all that
which
stuff.
Which is amazing.
Yeah, I imagine there's a lot of pressure with being on like the last 4-day deadline and having to open up this big treatment center. So that's
right.
heavy.
So y'all think about Chris.
Yeah.
Think about ways that you can support Chris. You know, shoot him a text.
Yeah.
Those
Pray
kinds
for
of
him.
things.
Pray for him.
Definitely. So I'm happy that Jimmy asked me to be on the show. So I work for the state of Arkansas on the same team as Jimmy with Kirk Lane.
Yep.
And my role initially was to integrate medication-assisted treatment into family physicians' offices, PCPs, get nurse practitioners waivered, help doctors learn the process to be waivered, and to work with Medicaid on paying for all that, because you know everybody got to get paid, right?
That's awesome.
I was shocked when I found out that a lot of treatment was cash. So I'm very excited to be part of that effort. Now, March 6th, 2020, as everyone knows, was a big day. It was actually March 11th when we had our first confirmed case in Arkansas, but March 6th was the day that I was borrowed temporarily for a couple weeks to be the DHS medical expert for COVID. So I work with a great team. I do more of the information review, which serves me very well as a nerdy Enneagram 5. I love to read. So I read all day long about COVID. I study it so you don't have to. I love to answer questions. That's not our total topic today, but I know that Jimmy has some questions. He's been hitting me pretty hard the last 15 minutes while they've been checking my mic, making sure that I can respond accurately to him. So being with DHS during COVID has been a huge challenge, because if you don't know a lot about DHS, we have 5 human development centers that serve intellectually and developmentally disabled people. All of those employees, so that's human development centers. Then we have the Arkansas State Hospital, which is an acute psychiatric facility. And then we have the Arkansas Health Center, which is a long-term care, aka like a nursing home, that serves people with mental health. And they have a ventilator unit. So people who are on a ventilator all the time live there. Right. So we've got 7 facilities, we've got 3 different levels of care, and then we've got all of our county offices, all of our 7,400 employees. And I'm on call 24/7. Anytime anybody needs advice, I'm on call. I actually just gave my phone to Ricky. It feels so good to give my phone away for a few minutes. This is my personal phone. But honored to serve the state in that way, but definitely missing my involvement with the recovery community. I'm still doing my best, but COVID is all-encompassing, as you can imagine.
Yeah, it's playing a big toll. One of the, well, thank you so much, Jennifer, for all that. So when I first met Jennifer, you know, obviously she came on the team, and this was pre-COVID, and so we didn't have to jump through all the COVID-19 hoops. And so Jennifer was actually working day to day with us developing treatment stuff, recovery efforts. Like I remember you sitting down and helping me develop policies and procedures for one of the recovery programs inside a jail.
Right.
And so thank you for everything that you do.
Absolutely.
So what makes Jennifer tick though? What's a little bit about Jen's story? Like, you know, we joke with her, Jenny from the block.
It's Jenny from the Rock.
Jenny from the Rock. Yeah,
that was my camp name. I was the camp nurse one summer. So I made the mistake of telling that to Jimmy, and now that's what he calls me all the time.
Yeah, okay.
So what makes me tick? Well, when I was 6, I did a book report on Clara Barton. For those of you who don't know, Clara Barton was a Civil War nurse. And when you're 6 and you read a book about a girl charging the battlefield and taking care of all these people and saving lives, you're like, yeah.
Okay.
I want to do that.
Yeah, not me.
So,
but hey, okay, back to you. I'm sorry.
It's fine. We're not all built for what we're built for.
Yeah.
So, so I wanted to be a nurse since I was 6 years old. My mom talked me out of it for a little while. Hi, Mom. She said that I would not like it, that it would be all gross stuff. And I listened because your mom's opinion is very important.
Right.
And I ended up going to college as a theater and psychology major. Theater was my intent. Psychology was what I wrote down so I wouldn't get in trouble.
Right.
And within a month of me starting college, September 11th happened.
Yikes.
And that just completely shifted my worldview of, do I really want to be an actress? Do I really want to be a therapist? Or do I want to touch people at their most hurting and help them?
Right.
So while I was in college, I met a nurse practitioner, and I had no idea what a nurse practitioner was. And she took me under her wing. Her name's Darlene Shipman. She's still at Cardiology Associates in Jonesboro.
Right.
And she talked to me about, you know, finishing up my nursing degree, coming to work for her. I worked for her for a year, and then going on to get my nurse practitioner. So I started my career in critical care. And I tell you all this because the end of the story and the beginning of my time at the state is what makes me tick.
Yeah.
So I finished up my LPN early, which is licensed practical nurse, and I went to work for Darlene for a year in Jonesboro while I finished up my RN, a registered nurse.
Right.
And then at that time you had to work for 2 years before you could go to nurse practitioner school. So I went to work in the CCU, which is cardiology. So I dealt with a lot of heart attacks, a lot of emergencies, but we never had to give Narcan, ever. It was like an unprecedented thing. We never even thought about drug overdoses in the CCU. Yeah. So I went to nurse practitioner school, went to work at UAMS, and started seeing more. This was around 2007 through 2010.
Started seeing more overdoses?
Started seeing more people with their lives ruined by drugs.
Right.
So started seeing people who were in need of heart transplants from bacterial endocarditis, from IV methamphetamine use. You know, started seeing people in acute psychosis from drugs. You know, I worked in interventional radiology, started doing a lot of liver biopsies for hepatitis, and just started seeing how it was ravaging.
Yeah.
So once I finished my nurse practitioner, I kind of jumped around trying to find the perfect job for me and my baby.
Yeah.
Because I was pregnant my last year of school. And every teacher will tell you not to do that. But after 3 years of infertility, that's what I wanted to do.
Right.
So she was right. I didn't get any job offers from everybody that I worked with when I was pregnant because I was pregnant. They knew that I might not stay long or I might want to work part-time or that kind of thing.
You might want to go be mom.
Yeah.
Right.
So I worked for a pain clinic.
Oh, that's
and
nice.
then I started seeing my patients spiral downward.
Yeah.
So I ran away and I went to work for a cardiologist, and I started seeing people who had used drugs who now had lifelong heart issues.
Yeah.
And then I went to work for a neurologist, and I started seeing people who were using drugs having seizures and being on seizure medicines. And then I went to be a hospitalist, and oof, man, we saw that psychosis from marijuana back in 2015.
Yeah. Guaranteed.
So all of that led up to my last full-time in-person position, which was at a small rural hospital in central Arkansas. And at that small rural hospital, they wanted me to be there so much that they let me do whatever I wanted. So I worked Monday through Friday, 8 to 4. I only took call from 8 to 4. and I covered every inpatient in the hospital. So everybody in the ICU, med surg, and then I was on call for the psych unit.
Yeah.
So during,
You see a lot of drug-induced stuff at that level.
yeah,
Right.
yes, but I was in charge.
Well, that makes it a little bit easier.
I had a collaborating physician, but a lot of times it was just me seeing all these patients. And my certification is adult acute care, which means if you are 17 years old and 364 days, I can't take care of you. I can only do 18 and up, which is why I never worked in the ER full-time as a practitioner.
Right.
So in our ER, during my Diva Princess hours,
Diva.
we lost 7 young men under 45 to overdose in my ER.
Yeah.
In the middle of the day. I can still hear their mothers screaming.
Yeah.
The doctors that I worked with, a lot of them were not very familiar with how to run a trauma code because we were a little ER. Traumas were supposed to go away.
So this is the same day?
No, in a 9-month period.
9 months. Okay.
And they were all on my watch. Now, keep in mind, Diva Princess hours. That's just 1/3 of the time, 5 days a week. So it was way more than that in our hospital.
Yeah.
And it just really got to me. And I started thinking, you know, I really wish I could do something about this other than trying to pull people out of the grave when they're most of the way in.
Yeah. So you witnessed the devastation of addiction firsthand. So I get it. I'm starting to see it now, right? Like Jennifer is, from the time she's 6 years old, she's been inspired by this nurse that went out and saved lives of people that were dying on the battlefield. And so you're living out your dream. You're in your battlefield, which is the ER, and you're saving lives. Like you are now the woman that little girl read about.
Yep.
And you're living out your dreams, and all of a sudden you're seeing the people die helplessly that you're trying to protect because of addiction.
Right.
And so, wow, what a powerful thing. Well, thank you so much. And I know Mom's watching. I just saw Mom. Thank you, Mom, for making Jennifer. And thank you for giving it to us at the state. Definitely to Chelsea and I. Like, I cannot count that, like, your desire to help people go so much further than an emergency room.
Right.
Like the Jen Shuler I know spends hours at a time with addicts in recovery, me and my wife particularly. Anytime we're struggling or having hard times, like you're one of those go-to people we call. And so on a personal level, Chelsea and I freaking love you and adore you. So
Thank you.
And anybody who doesn't know you, I encourage you guys to follow Jen. You've got a social media page too, right?
Yeah, yeah. I've got a public one, and then I have my personal one.
So how do we find the public one?
It's Jennifer Shuler, APRN.
That's awesome. So go like that and follow that page. And if you have questions surrounding COVID or addiction, inbox Jen, because we're going to get into some really juicy stuff in a minute. So
he is ready.
Tag your friends, invite them, invite people to come watch this video because it's going to get juicy, and you're going to hear about rumors surrounding COVID, people at risk. You're going to hear about the vaccine, where we're at in Arkansas with the vaccine. But first, you are working with a grant, right?
I am.
To combat this stuff, like an emergency. Tell us about that.
Yeah, so my initial goal with the state was to try to get people to provide treatment. So I've spent a lot of time talking to providers about that. So last April, Kirk and Deborah approached me about being the project director for a new grant, which was an emergency COVID grant from SAMHSA, the Substance Abuse Mental Health Association, about treatment for people who have issues either caused by COVID or aggravated by COVID, and a way to get them 24/7 help in a safe way. So you can see Jimmy and I are closer than 6 feet apart. We did get our temperatures taken. We did wash our hands. Ricky's very we did have our masks on. We both had on our matching recovery clinic masks.
True.
And we're both been vaccinated.
Vaccinated.
Yes.
And I have not grown a third arm.
I'm not an X-Man either. I really wanted to be Jean Grey. I had goals.
Yeah.
Okay.
Yeah, that's good. I didn't want to jump the gun. We're going to come back to the X-Man.
Yes.
Tell us about this grant.
But, you know, right now, if all of those things were not true, Jimmy and I would not be safe.
True.
So if you needed mental health and substance abuse counseling,
All right.
this is what you would expect, right?
Yes.
But in the world that we live in, this isn't safe.
Right, right.
So that's why AR Connect was created. So AR Connect is a substance abuse and mental health treatment program that is virtual. So it is phone and video. A registered nurse will answer the phone 24 hours a day, 7 days a week, and screen you for treatment. We
Okay.
want everyone to call.
Now, who pays for that?
SAMHSA.
So you can get mental health services, addiction counseling right now for free.
Yes.
No insurance, no nothing. I can just call and you will give me some free counseling in Arkansas.
Correct.
Are y'all hearing that? Right? Like, people blow me up every day. I need help, I need help. Who do they call?
They call 1-800-482-9921.
Can we get somebody to type that in the chat box?
Yeah, 1-800.
Does anybody ever get turned down when they call?
No.
So there's no, so don't inbox me later talking about I tried and they say they could. No, that doesn't happen.
No.
If you call, you will get help.
Correct. So the name.
That is
Yeah.
beautiful, Jennifer.
It
Thank
is.
you.
It is. I have never been a grant person. I've
Yeah.
never been a project director. As you heard from my very long story, I'm an acute care nurse practitioner. I
Yeah.
like to take care of people.
Well, now you direct a grant.
And now I direct a grant that takes care of people. And
That's
it's
awesome.
awesome. But I was up late last night and early this morning writing the budget because this grant has done so well. We got more money.
Yay.
We got more money.
Means more
More
help.
money.
Right.
So it was initially a $2 million grant.
Okay.
They've given us an additional $2.8 million.
So how long will that carry us to?
So the program was supposed to end in August of this year.
Okay.
It's going to end in August of the next year. So we're getting an extra
That's
12
awesome.
months.
So you guys can call right now, no matter what it is. There's
Correct.
any kind of trauma, any kind of, like, this is where it's at. Now, can they connect you to treatment there? What do we expect when you call?
So once you call and you talk to the RN screener, if you meet the certain parameters, you know, because everything's got a parameter to make sure that you don't get lost in the system, right?
Yeah.
So then they will set you up for treatment. And the treatment right now is, you know, Monday through Friday, 8 to 5. But with the new money, we're going to expand it to later nights, 2 nights a week, and some weekend hours.
That's awesome.
So the treatment will be televideo, or it will just be telephone if that's all you have, or you can have video. And right now we're averaging 5 sessions per participant. So the goal of AR Connect is to connect you to who's going to take care of you after the money is out. But if there's no one to take care of you, if you have, like Jimmy said, if you have nothing, they will take care of you.
That's
And they'll
awesome.
try to help you figure out what resources you need. So it's a no-lose situation. And it's not just for people in recovery.
Well, then who else should call? Who else?
Everyone.
Everybody.
Everyone. I cannot tell you how many of my nurse colleagues I have talked to that have horrific PTSD and trauma from taking care of COVID patients.
Ooh, that's good.
One of the aims of this grant is to treat substance abuse, mental health, and healthcare workers. So as a healthcare worker for a real long time, I've witnessed hundreds of deaths, and I personally have gone through EMDR for PTSD.
So peer recovery specialists should really tap into this.
And we're going to hire some with our new money.
No, I didn't know that.
I
can't
dropped
just-
a bomb on Jimmy.
You can't just do that to me, Jennifer.
I dropped a bomb on
Wait,
Jimmy, y'all.
Okay, so you're gonna wait. Back up. Okay, so you got this new money,
We got new money.
and so being that it's Jennifer, I'm sure it'll be a good salary. That's good. I'm not gonna put you on the spot on that.
I don't have it memorized, Jimmy Jam.
Okay, I'm tripping a little bit now. How many peers are you gonna hire?
I'm not 100% sure,
Okay,
but it's more
okay.
than one.
And it's in Little Rock.
Yes.
Hey, that's awesome. Okay. So people in recovery have been added everywhere. I love it. So if you're a peer support specialist and you're watching this, and I know for a fact a lot of you guys are, and you'll see it.
As soon as we have postings,
Yeah.
I will give them to Jimmy.
Yeah, we'll get them out there. But,
Yep.
but more so important, Jennifer just said that we qualify as healthcare workers to call. I would encourage you guys to use this AR Connect, because this is what I experience, right? And I know I'm on a little bit of a higher workload than most peers would be. But I get so depleted from pouring into other people
Yep.
all the time. Like, my work schedule is not 8 to 4. My work schedule is 24 hours a day, on call. I'm subject to have Zoom meetings for grant projects that I manage surrounding providing a service to people at 9 o'clock tonight.
Yep.
Like, I mean, you get it. State business doesn't end.
People don't get sick between 8 and 4.
No.
People don't only need help between 8 and 4.
That's good. That's good stuff, Jen. Man, so if you're a peer worker and you experience workforce fatigue and you get depleted from constantly providing care to others, I mean, that's what you are. You're a service provider. You're providing a specific level of care to a patient or a person or anybody, right? Like, call that number. AR Connect is set up for you as well.
Yes.
So that's fabulous, Jennifer.
You know, we really want to serve the people of Arkansas. We want to serve everyone in every capacity as needed, and that's what we're here for. Now, if you have insurance, they have to do some lovely work around your insurance. They will expect you to provide that information, but that's just for federal reporting. So the federal government cannot pay for your treatment if you have a payer source.
Right.
But just know that, because I've had a few people not call back because they're like, well, they asked for my insurance. Well, they have to. It's federal government. But this program is for everyone, and this program is expanding and growing and adding peer support.
That's great.
And it's emergency COVID. That's the name of the grant, emergency COVID. We just renamed it AR Connect.
That's awesome. That's so awesome. So let's talk, where are we at with COVID currently?
Well, we had a forced shutdown last week.
Yeah. Snowvid.
Snowvid.
Yeah.
So I'm really hoping that the low numbers we're seeing stay that low, but I anticipate they'll start going back up once people are out about. Everybody got a little cabin fever.
Yeah, the lockdown, listen, it was nowhere near as fun as the first one.
Right.
Like, when the state sent us home to work that first time, I was cool with that. Like, I worked harder during that time because it was like, my job just amplified during that first shutdown.
Right.
This go round, being trapped in the house with my wife, it wasn't quite so fun. Like,
And having to work.
Yeah.
There's no such thing as a snow day for the state now.
No,
we got
no.
laptops.
Yeah,
we got work.
Yeah, so at this point, I had school going on in one room for my kids. I had my wife doing Zoom meetings in one room, and then I'm at the kitchen work. It was chaotic. Like, it was not a happy snow day vacation.
Yeah, my kiddo definitely liked to interrupt every time I was busy.
Like, it's not just yours. Are they teaching them that in class?
It even happened this morning.
Mom's in a Zoom meeting, go ask for chocolate milk.
When we first shut down, I did all my work in our sunroom, but our sunroom is tiny.
Yeah.
I live in a little tiny house.
Yeah.
And it just got too small.
Yeah.
So this time I've been working in our living room, but my husband is too, but we both have on our noise canceling headphones
Right,
and our
that's good.
laptops. And if we're both having to talk, one of us will leave and go to the dining room or the bedroom or something.
Right.
So Jimmy has got so many questions for me that
I
I'm
do.
really hoping that some more people type in, so this isn't the Jimmy wants to know about COVID show, because we could do that at home.
Yeah.
Like, I want to hear from y'all. Like,
Yeah. For sure.
yeah, we did a little discussion at the beginning about COVID. So, where are we with COVID? Was your question?
Yeah, where
I
we at
hope
with
we're
the
getting
vaccine?
better. Well, the vaccine, we're doing the best we can. So there's limited amounts of vaccine, which is why it's being rolled out to certain populations. Now, I hear a lot of people complain about it's not my turn yet and I'm high risk. So the way that all of this was decided was recommendations from the Advisory Committee on Immunization Practices, which gives that information to the CDC. And we are lucky in Arkansas that the head of the Advisory Committee on Immunization Practices is our Arkansas Department of Health Secretary, Dr. Jose Romero.
Yeah.
He's the boss of this committee, y'all, the one that's telling the whole nation what to do with vaccine.
That's
So,
Arkansas.
yes.
Okay. There's
So-
a lot of good stuff. We're
Yeah.
putting Arkansas in charge of a lot of stuff.
Yeah, so they look at risk benefit.
Yeah.
Okay? You can have every health risk in the world, but if you're able to stay home and stay away from people, you are a lot safer than a nurse that's going into an ICU every single day and getting exposed.
Right.
If you, like my dad, have cancer, it's cured now. My mom's going to get mad. She don't like his business on the internet, okay? Your oncologist tells you, you need the vaccine. You're not 70. You don't get to jump in line either.
Yeah.
Because my dad can stay home. He can isolate.
Yeah.
He's not a teacher going to be around 15 kids.
Yeah.
So the vaccine rollout is going as well as it can.
Right.
Dr. Dillahay does a really good update every Monday at noon on UAMS on Zoom about how it's going.
Right.
And then I sit on a call every Friday at noon where we talk about how it's going. And since the National Guard, Colonel Ator came in, we're really getting better with our distribution, but we just have such a limited number, and we want to make sure that every county in Arkansas gets at least some.
Yeah.
So that's what we're working on.
So you've got a couple of questions here, and,
Okay.
then we're going to get back to mine. Mine are fun questions.
He wants to be Wolverine.
Hey, listen, Chelsea wants to know, are the numbers going down? And you actually just answered that, right? Like, they are because of the snow, but we expect an inflation.
I'm really hoping that people are learning that you can stay home and that it's not near as hard as what our elders have had to sacrifice. You know, my grandfather was a World War II vet. He passed away 3 years ago.
Yeah.
My grandmother lived in France and was starving in World War II. And, you know, the things that we're being asked to do to stay home and watch Netflix
It's nothing.
are nothing
The
compared.
Man, don't get me started on it. Like, the way we complain today compares to how you and I grew up, it's insane.
Yeah, so I'm really hoping that people will see that if you just stay home,
It's not so bad.
you can slow the spread and we can keep our hospitals where they're working at peak condition.
Right, right. So Parker Blake says, how can I get my wife the vaccine? She is a waitress at a restaurant that is on the front lines too. In their eyes, she's considered an essential worker. We have a newborn child and would really like to get back to going to personal recovery meetings. So Parker and his wife are staying home. They're not even going to their recovery meetings. And there is a difference between Zoom meetings and in-person
Absolutely.
meetings.
I think it's the longest I've spent with you in a year.
Yeah, definitely.
Like we always see each other on Zoom or a
I'm
quick
just
cross by
now
at
going to-
office.
Chelsea went
Yeah.
to her first in-person meeting last night out of all this and said,
Yeah.
she literally, Jen, texted me, Parker, we feel your pain. I understand what you're going through. I'll let Jen answer your question in a hot second. Chelsea literally texted me and said, oh my gosh, babe, I almost feel high. This feels so good. Like, she experienced a euphoria release at being around
Endorphins.
around a
Yes.
group of people because
Knowing
she's
you're not-
vaccinated
yeah.
now. She felt
knowing you're
safer.
knowing you're not alone is a very, very powerful thing.
Yeah. So can our restaurant workers who are out in the field are they not able to get their shot?
So there is a list and some graphics on the Department of Health website. And I'm not sure if restaurant workers fall into essential workers or not. I know essential government workers are phase 1B, but they're still not able to get the vaccine right now because it's limited to just 65 and up and teachers. The 65 and up just happened yesterday. It's been 70 and up. And, you know, phase 1A was people who live in long-term care facilities and the people who work in healthcare. So I would have to check on that for you, Parker. I feel you. I'm sorry. But without knowing more about you, I don't know how much I can answer your question. But
Right.
feel free to message me.
So what about kids vaccines? Is that anywhere in the near future? You know, because one of the things that I hear a lot of people talk about is even though we're vaccinated, we still need to be careful because our kids aren't, and we may bring it home to them, and they may carry it and spread it. So talk to us a little bit about that, Jennifer.
Yeah, so kids' vaccines are currently being studied.
Studied by who?
By researchers. Vaccine creators. Okay.
I love it.
So, sorry, I got a little sass.
Researchers, not you.
So the studies right now are enrolling in major metropolitan areas. So there's not one close to us. So like Seattle's a hub. We've got one in Texas. We've got one in New England. And they're hoping they can make a recommendation soon. So currently, the vaccines are only approved. Pfizer's for 16 and up, and Moderna's for 18 and up. So kids are coming. Now, just because you're vaccinated does not mean that everything is gravy. So whenever you're vaccinated, like Jimmy just mentioned, you can still, we don't know, you can still contract possibly COVID, not know because you don't have symptoms, and pass it to someone else.
Yeah.
Right now, a lot of people are saying, well, I don't want to get the vaccine because it doesn't cover the variants. Right now, the vaccines cover the variants.
Yeah, it has. Chelsea and I were just watching on the news this morning. Like, the vaccine has done a great job at fighting off the variants.
Yeah, so right now the vaccine covers the variants, which is more of a reason for everyone who can to get vaccinated so we can get to herd immunity so we can go back to life as usual.
I love it.
Anyway, that's where we're at.
No, that's great. Okay, how do we follow Jen again? Jennifer Shuler, ARP. Thank you. Thanks for typing that in. That was Rick. Rick, you know, we get in trouble for mentioning Ricky over here on the sidelines, but I do it every show just to make people mad. Ricky makes the magic happen. If you guys could see what we see over here, it's awesome.
I'm telling you.
Jennifer, we hear a lot of stuff about our people in recovery, right? Like obviously in active addiction, which a lot of our viewer population, our people in recovery, our loved ones have said.
Right.
Obviously, we don't eat balanced meals. We don't really take care of ourselves when the driving force of our life is substance use. So are we, as people in recovery, more prone to catch COVID? Are we more at risk than most people?
I think it really depends on your personal situation. So someone who has an autoimmune disease or an immunodeficiency virus like HIV or AIDS, definitely more at risk.
Right.
Somebody who has a history of hepatitis could be more at risk. But really what we're looking at for at risk is chronic conditions. So when you talk about not eating balanced meals, not taking care of yourself, these are the people who are more likely to have hypertension, diabetes, obesity, which are studied risk factors that we know make you more at risk for COVID, for poor outcomes with COVID.
Right.
You know, just a BMI of greater than 30 puts you at a poor outcome for COVID.
What's a BMI?
It's the body mass index. It's the relationship from your height and your weight.
See, I'm learning. As we go, I'm learning, literally.
So we know that a BMI greater than 40 puts you at risk, but there's studies that say a BMI of 30 to 35 put you at risk. So if you want to know what your BMI is, don't tell me. Go Google BMI calculator and then put in your height and weight and see what your BMI is. You know, there are very few people who are at low risk of COVID.
Right, right. So I'm automatically thinking like myself specifically, and I'll use me for an example so that nobody else has to use yourself. Like I came out of a 23-year drug addiction, Hep C positive. And so a year and a half into my recovery, I was able to get and receive treatment for that. But I carried that liver disease, chronic liver disease, for 2 decades.
Right.
And so does that make me more potentially at risk?
Potentially, yes.
Okay. So there's a clear definition. And she answered that the first time. Just wanted to make sure we
Jimmy just likes to ask me questions.
Over and over. And so now let's talk a little bit about rumors.
Rumor has it.
Rumor has it, like and I'm hearing some good ones. Are you hearing good ones?
Oh yeah. I spent 9.5 hours debunking the Simone Gold American Frontline Doctor video.
What is that?
Don't look it up.
Talk to me about it. I've never even heard of it.
So there is a group of doctors that started raging at the Capitol, not like January 6th, but
They didn't kick the doors in.
talking about how masking didn't work and that hydroxychloroquine was the cure for COVID.
Okay.
So one of these doctors has now made a hour-long webinar that a lot of people watched before Facebook and Twitter banned it.
Okay.
It's still available on YouTube, but it's very well hidden. And every vaccine talk I have given, people have asked me about that hour-long webinar. First of all, if you are a physician and you want to do a talk, you are not going to do it at a church asking for money with nobody in masks and then get it taken off the internet. That doesn't mean it's true. Okay,
Yeah.
People are saying it's true because it was taken down. Second of all, if you are a doctor and you want to educate the world about something, you're not going to put up a website where you have to pay to look at it.
Right.
If you go to her website, you have to pay to look at it. So know your sources.
Yeah.
Anybody can make a website or a Facebook page. Jimmy and I both did.
Yeah.
You can look legit as possible, but the things that she says in this video are the craziest rumors I have ever heard. And when I bring it up to other healthcare providers, they just want to put their head in their hands and cry. They're so mad about it. So some of the questions Jimmy asked me were things that she said in the video.
No, she had our question. Okay, well, let's dig into it. Is the virus going to mutate me? Like, am I going to become an X-Man?
No.
I want to be an X-Man.
I want to be Jean Grey.
I don't know who I would be if I was
I see him as a Wolverine. Y'all type in what you see him as.
Yeah, type in if you see me as becoming an X-Man, because I've had both.
I mean, maybe
both shots.
Gambit.
What's Gambit do? Ooh, I like Quicksilver and.
Okay, all right.
I don't know. I like Wolverine too.
I don't know. My brother's 3.5 years younger than I am, so I'm very well schooled on my comics. Okay?
All the X-Men that really fascinate me are the women. They have all the cool powers, like Storm and Jean Grey, and so that sucks. For me to say that says, I want to be a woman. So.
It's not going to mutate you.
It's not?
No. So what the vaccine currently is, and when I explain this really simply, it's not 100% technically correct, okay? So what is in the vaccine is mRNA. So that hearing that RNA makes everybody think DNA, okay? So M is messenger RNA. So it's a portion of the genetic code of the virus, okay? And they put it inside a fat bubble, okay? Lipid cholesterol, okay? They put it inside
literally a fat bubble.
A fat bubble.
No, not
because
like
it's
a fat bubble.
Yeah, it's so fragile.
Right.
So they package it in a fat bubble.
Okay.
And that fat bubble, once it's injected into you in your inoculation or vaccine, that keeps it safe until your body can read that mRNA, which is like a blueprint or a recipe card. So basically what it does is it teaches your cells what to look for to know what COVID is. So your internal immunity can fight it off. Right. So basically, the other things that are in the vaccine, a lot of people are like, well, I don't want vaccine. It's got formaldehyde or mercury or whatever in it. It's like a cake, y'all. It's got fats, salts, buffers, sugar.
Yeah.
That's all that's in the vaccine. There's no microchips.
No microchip.
No microchips.
Wow.
No microchips.
So that debunks that theory. Okay.
If the government wanted to track you, you already gave them permission.
Yeah. I guarantee you. There's a Tom McDonald song that talks about we're still, in a box. They just removed the cages and gave us little screens.
Yep.
So another big thing that we're hearing, Jen, is that the vaccine affects populations of color, African American, minority populations. Does the vaccine affect people differently based on race?
So from the studies that have been completed and reviewed by Pfizer and Moderna, the answer is no.
Okay.
The problem with the studies is that we did not have enough people of color participate. And that is from a long-standing issue of wrongs that were done that perpetuate research today.
Yeah.
Of the 42,000 people that were recruited to do the Pfizer study, half of them got the vaccine. Only 1,900 people of African American descent got the vaccine in the study,
Small number.
compared to 15,000 people,
Yeah.
Caucasian. That does give you some pause, but of serious long-term side effects, zero in populations of color.
Yeah. What about gender?
Gender is not, I mean, whenever you do a randomized controlled trial, you want a sample of as many different types of people as possible that are safe to participate in the trial. So they had a pretty even male-female gender split, and they did not see a significant difference.
So Chelsea's not going to catch it first.
And you're going to ask me about blood type, and I'm about to tell you we don't know. We're seeing some trends, but we don't have a specific trialed something that I could quote to you about which blood type's going to get it or not get it.
My blood type is dope anyway, so just listen.
Mine's A positive, like my grades. Thanks, Mom.
Ooh, you know, I will never forget, Jennifer. Everybody was talking, I am not getting that vaccine. And Chelsea said, babe, are you getting the vaccine? And I said, I don't know. It hasn't really been tested. And she said, oh my gosh. She said, like all that dope you put in your body was FDA approved. Get out of here. And the logic of that, right? Like, it was like a light bulb went off. I was like, oh my gosh, she's right. I literally snorted dope off of the back of a toilet where you know, it's insane the stuff we did to use. Now, granted, I get the other side of that too. Like, I did some stupid stuff then because I wasn't thinking clearly. Today I am,
Right.
you know, but I haven't experienced. I got sick for a day on the second shot. That was it. You know, I'm very grateful. Just the confidence that I have to be able to. I feel safer to go to a public meeting today.
Right.
You know, this has been a really, really great show, Jennifer. And so, if you're watching, share this video right now because you saw and witnessed and heard the pertinent information that Jennifer brought us. And so this is stuff people need to know. And so thank you again. And we always like to give the guest speaker the last few minutes to say whatever you want to say, whatever statement. So this is your time, Jen.
Thank you. So I could see the camera, and I just got told to wrap it up. So I just want to let you know that AR Connect is here for you. The 1-800 number is 1-800-482-9921. As Jimmy said, he and I are 24/7. Let us know what you need. If I don't know the answer, I'll find it for you. A lot of people don't realize that being called an expert doesn't mean you have all the answers. It means you've done the most studying. So
I go through that.
there are all kinds of things that I still need to study and find out, and I'm happy to help you in any way that I can. If you are one of the lucky people who's eligible for vaccine now, and you are excited about that and ready to get it, you can go to the Arkansas Department of Health website and click on the COVID-19 vaccine information, and there's a list of pharmacies in your county that will be given allocations, and you can sign up for an appointment through there. You can also go to arrx.org, which is the Arkansas Pharmacists Association, for that list, and then Baptist and UAMS are taking online appointments. So please don't sign up at 15 different pharmacies. I know you're excited, but it slows everybody down. But just if you are eligible for the vaccine, if you're ready to get it, go ahead and sign up and get on those waiting lists, because once we all get vaccinated, you can go back and have your in-person recovery meetings. And one of the guiding principles I've had during my time in this work is from my favorite YouTube video. Jimmy knows all about it. It's about addiction. I'm blanking on it. Everything you think you know about addiction is wrong.
Yeah, that is a good one.
And the very end of it, it says the opposite of addiction is not sobriety. The opposite of addiction is connection.
That's
So
fact.
those connections that you guys have are what keep you clean, and I want you to continue those. And if you don't have a connection, reach out and we will get you one.
Yeah, absolutely. Thank you so much, Jennifer.
Thanks for having me.
See you guys next Wednesday at 11. We have got a fabulous show. We've got John and Carol Shinhoser flying in from D.C., from the McShin Foundation. Going to be fabulous. Carol is one of the leading advocates for addiction recovery, and John is the president of the McShin Foundation, the largest RCO in the nation. So we are excited. See you next Wednesday at 11.